right, you people. I am back again. Like I mentioned to you guys earlier, I am here at Chambers of Commerce Conference, and I've gotten an opportunity to meet a doctor from Kenya. He is an OBGYN, and when I saw him, I thought that there are some concerns in Africa that we probably need to talk about. Dr. Can you please introduce yourself?
Yes, my name is Gichuyia Nthuraku. I'm an obstetrician and gynecologist.
Right.
And I'm also the County Executive Committee member for Health Services and Sanitation in Nthuraku County, Kenya. That is County Minister for Health Services and Sanitation.
Okay.
Yes.
Awesome. What does a County Minister for Health and Sanitation do? Just help us understand.
Yeah, a County Minister for Health Services and Sanitation is mandated to develop policies for health services and sanitation in terms of what is the strategic direction your county will follow in terms of health services. Yeah. And of course, policies are developed at that level and then implemented by the chief officers who are supposed to be an equivalent of the principal secretary in the national government. In our new dispensation of governance, we have 47 devolved units called county governments. Yeah, so that's my duty, to develop policy and make sure that the county is, of course, served by the workers who execute those policies. Yes.
Okay. There are some tests that generally women in Africa do not get done, only because sometimes healthcare could be expensive or not accessible, and I'm talking about like GYN visits, pap smear. How do we make that available for women? How do we also make services like that available and probably even free for women in Africa, in Kenya in particular?
Well, I think it is important to realize that Africa is not just a uniform flat service like a table. Even Kenya itself is not, the services available in one part of the country may not be available elsewhere. But generally, every county in Kenya has services available for each section. And each section of the society. We call them cohorts. All the way from birth to elderly age. Yes. There are services in every county that are available. But then there are disparities at times because of the historical backgrounds of our development as a country, where you may find that some sections of the country, like the part of the northeastern part of Kenya, where historically there have been a lot of underdevelopment, you find that it may not be exactly the same as some other part of the country, like for example the central region of Kenya. Even Nairobi itself, the kind of services you get from the upper part of Nairobi, the western part, the more affluent areas in Nairobi, is not the same as Gikomba or other Madhari or those other places, where people are overcrowded and these are informal settlers in Nairobi. So you find that the same problems that you find in some parts of New York, for example. Right. There are some places in New York where the services are very, very poor, including medical services. So the kind of challenges we have in Kenya are purely because of the maldistribution of these amenities. Yes. Okay. But when we talk about the pap smear is a very simple, easy method of detecting cancer of the cervix, which is a very, very common cancer in our country. Cancer of the cervix is a sexually transmitted disease caused by the human papilloma virus, which is transmitted sexually, and it is extremely easy to diagnose early cancer of the cervix and treat it 100%. Okay. They are divided into stages. Stage 1 and 2 are quite easy to treat, but then when it goes beyond that, then it becomes more complicated and more difficult to treat, because if you catch it early, 100%, and of course the way you catch it early is by making sure that at least you have a pap smear, twice a year. Yeah. And if you cannot afford twice a year, then you just have it once per year. Yes, so it is possible. Yes, but the development that counties are supposed to make is to make sure that we train enough cytologists. Cytologists are technical people who take those smears and then they stain them and look at them through the microscope and make the diagnosis, which of course alerts the people to do the necessary. Yes, when it is very early, it's very easy to treat.
Right.
Yes.
Okay. I want to talk to you about something, that we have seen on social media. And to be honest, when I was a teenager, I have friends that passed away because of teenage pregnancy, and they overdosed on pain medications, aspirin, in hopes to, terminate the pregnancy, and ended up dying. And on social media, I've seen, aborted babies thrown in, garbage cans, just in different places, yeah? So, which it tells me that we have a problem. Do you think that our country is ready to probably even have abortion legalized?
The issue of maternal deaths, we call them maternal deaths because these are pregnancy-related deaths. Abortion is an extremely, it's on a very high list. In fact, it's one of the biggest causes of maternal death in Kenya, where about 60% of all the abortions are usually of unintended, because you can have an abortion which occurs spontaneously, meaning that the body just starts aborting for one reason or the other.
Right.
But then the ones which are usually caused, like the ones you have just described, people taking some pain medication, etc., etc., those are pregnancies that cause the biggest problems in terms of complications. Of course, you realize every drug is actually a poison. As long as you take it within the prescribed dosages, that's okay.
Yeah.
But the moment you overdose yourself, like those drugs that you mentioned, the painkillers, including what Americans call Tylenol, the equivalent of paracetamol in our East African region, it may cause liver damage, liver necrosis, and of course a very severe problem. Aspirin, even if it looks like a very innocent painkiller, it can actually lead to a lot of hemorrhage when it is taken as an overdose. It causes a lot of bleeding. So, and of course, there is a time that chloroquine was the most favorite in East Africa. Chloroquine was used for treatment of malaria, but most of the people that were using drugs to terminate pregnancies, they used to overdose themselves with chloroquine. So, abortion is a big issue. Our constitution talks about terminating pregnancy if the life of the mother is in danger. It does not permit abortion on demand. Therefore, it is in the doctor's domain to make sure that at least you conduct yourself according to the constitution, and at the same time making sure that the life of the mother is on that is to be defended during that time. Yes, it is true. Abortion is a big issue. We still continue talking about it, and the moral aspect of it in terms of the constitution again saying that life starts at conception, where you are not supposed to terminate at all, even if it is rape. Is something which is an ongoing debate, and I'm sure it is actually almost in every country that people are talking about abortion, etc. Yeah, so we do not abort women on demand in Kenya because it is unconstitutional. It's a crime. It's against the penal code. But of course, we also spend a lot of money treating women who have already had backstreet abortion. Yes, is a big problem.
Exactly.
Yes.
Yeah, and that's why I'm asking this question, because just like you mentioned, a lot of people are going to backstreet abortions because abortion is not legalized.
Yes.
And so I would think that our country needs to be thinking in terms of legalizing abortion, especially in the cases of rape and incest. I don't think anybody wants that reminder, a constant reminder of what they went through, and I think they should be able to abort at that time.
As a gynecologist, I must tell you that we in Kenya and in East Africa have engaged a lot in terms of women's rights and reproductive rights, for that matter. And our feeling is that once a patient, a woman designs that, look, I'm going to abort, whether you put a law there or not, she will still do it. We have done extensive studies to support that. And there are proponents who say, look, people should access abortion, especially in certain special circumstances, like rape, for example, because it's extremely traumatic to allow a pregnancy to proceed, which is a result of rape. It continuously reminds somebody that something terrible happened, and that is why you got this baby. And on the other hand, the moralist who says, look, this is a human being. What right do you have to terminate? You see, the debate goes on and on and on. And unless there is now a very bold discussion and mechanization that is going to be favorable to the community, for that matter, I think the matter still is unresolved. Yes. But for now, we practice according to the constitutional and legal provisions. Yes.
And very quickly, Dr. Ari, if you can tell us what is a major concern as far as Kenyans are concerned, and what do they really need? What I'm talking about, I know there's a lot of cancer right now. My mom is actually going through chemo. She has cancer, and so
cancer of which part?
Ovarian cancer.
Oh my God.
Yeah. So how do we get an early diagnosis? That's a story I will tell you actually out of camera, because it's it's a
very devastating. Yeah.
But how do we get early diagnosis of this cancer so that we can get a handle of it early and probably even get treatment? Because ovarian cancer, my mom is over 70. She can get a hysterectomy and it's okay. Probably would treat that. But how do we get early diagnosis?
Of all the gynecological cancers, ovarian cancer is a difficult one to diagnose in good time. You realize the abdomen and the pelvis is more or less an empty space where the organs that hang around there, including intestines, including the gynecological internal organs, are there. It's not like a leg where a swell, or even a face where you can swell and then you see a swelling. So a tumor developing in the ovary is something that is very difficult to detect very early. There are some areas of detection called cancer markers, but even among the so-called developed countries, cancer of the ovary has eluded early diagnosis. It's not like cancer of the cervix, where you can say regular pap smears can help you to check it out. But scheduled gynecological examinations can actually detect an ovarian cancer before it goes very far. So frequent visits to a gynecologist, who can even proceed and do ultrasound, either transvaginal ultrasound or even abdominal, where you can detect an ovarian tumor before it bursts out of the skin which covers the cancer. Because once you discover it early enough, surgical resection is 100% curable. Yes. Yeah, something like the breast cancer, and the breast grows out, you can see it. It's actually easier to detect early, because it's just a matter of developing that habit of pressing on the chest against the rib cage to detect any mass that might be growing on the breast. Yes, but there are some other cancers that are very difficult to really diagnose, and these are cancers which are basically internal. Yes. Cancers that are internal in the abdomen are very difficult to detect before they grow out of, yes.
What about fibroids? Is it, in your experience, is that a prevalent problem in Kenya?
Fibroids are the commonest gynecological tumors. We call them gynecological tumors simply because they are swellings. And we know, for example, Africans or African American women have a higher prevalence of fibroids compared to their Caucasian sisters. Nobody really knows why, but we suspect that immunological aspects, that is how the body reacts with its own immune system, and of course the genetic aspect of us Africans, predisposes us to develop fibroids. Now, not every fibroid should lead to problems unless, of course, it develops the symptoms of either pain or excessive bleeding or pressure on certain areas. So as long as the fibroid is innocent, meaning that it's not cancerous, there's no need of bothering it.
Could it be a cause of infertility?
Yes, it can be. That's why I'm saying that depending on where it is located. For example, if it is located along the fallopian tubes, and tubes are very thin, very, very narrow, it is possible for a fibroid to block the entrance of the path where the ovum, that is the egg, and the sperm usually pass. So if it is growing around there, it can actually prevent fertility. But even if it is not growing there, we know that women with fibroids tend to be to be less fertile in terms of achievement of pregnancy compared to those that are not. But that is when you consider millions and millions of women statistically. But there are so many women walking around with fibroids who have no clue whether they are fibroids, and there are very many babies, very many. So it's not that everybody with a fibroid is going to suffer from infertility. Yes, I have delivered very many women with huge fibroids, going all the way, even showing as if it's a pregnancy. Yeah. But it's not. Yeah.
Okay. All right. Then how can ladies out there that are watching, if they wanted to come to your facility or at least your clinic, how can they reach you? Is it possible?
Yes, I gave you my card. I have an email there. I have all my contact there, even where I'm located. So it is possible.
Okay.
Yes.
Okay. Yes. All right, you guys, I will post this card for you, and if any of you will want to reach Daktari, I will post it for you, okay? And you can have his information. Daktari, I know we are pressed with time, so I'm gonna let you go. But thank you so much for taking your time, at least to educate us a little bit, and I will catch you again.